Welcome to DCA TV. I'm Victoria, and we have Dr. Mary Lupo today on our show, the woman behind the vision of Lupo Center for Aesthetic and General Dermatology since 1984. She is a board-certified dermatologist and clinical professor of dermatology at Tulane University School of Medicine. It is November, and it is the National Healthy Skin Awareness Month, and today Dr. Lupo will provide you with some useful tips on how to maintain healthy skin. Welcome, Dr. Lupo, and thank you for being on the show with us today.
Well, it's my pleasure. I love to talk about healthy skin.
Oh, good. Well, what is healthy, beautiful skin?
Well, the most important thing that people need to do to have healthy skin is to have a healthy lifestyle. And if I may go through what I think are the most important things, I think number one, I think you need to use daily sun protection. Okay. What daily sun protection does is prevents the ongoing insidious damage to the subcellular structures of the skin, the DNA and the collagen and everything that's important to keep our skin healthy. So sunlight produces free radicals that actually damage these things and accelerate the process. And even though people say, oh, I don't need a sunscreen, I'm not out in the sun, believe it or not, you get sun exposure insidiously all day long. And what a lot of people don't realize is the aging rays of the sun are really the longer wavelength rays, which are the UVA and the infrared, and they're there all year long. The UVB, which is the burning ray, which is highest in the summer, that changes depending on the time of day and the time of year. But UVA is pretty much the same all year long. So remember, UVA stands for aging. And so tanning beds and ultraviolet A light actually accelerate the aging process. So you want to guard against accelerated aging from sun exposure, even incrementally in a low level on an everyday basis while driving or walking your dog, etc. So that's number one. Number two are to do other basic things that are good health. Make sure that your diet is healthy. Make sure you're eating a lot of greens, a lot of proteins, and avoid sugary foods, avoid processed foods, avoid what are called the simple carbs, like white bread and cookies and things like that, and go with the carbs that are what are called high fiber carbs, high protein carbs, quinoa instead of white rice, for example, which is higher in protein, or you can go with farro, which is higher in fiber than rice. So there's a lot of really strategic choices that you can make with your diet that really make a big deal of difference in how you look. Go with dark green vegetables and darkly colored fruits like blueberries. Blueberries and kiwi and raspberries are higher in fiber and antioxidants and lower in sugars than a lot of the other fruits that are out there. So a diet is very important. Then there's supplementation. I think the most important supplements that people need to take for their skin are the omega-3 supplements and vitamin D. Remember, vitamin D can be gotten naturally from UVB exposure to the sun, but unfortunately UVB exposure to the sun causes sunburns, brown spots, aging of the skin, and skin cancers. So we want to avoid UVB. So get vitamin D supplementation, because vitamin D really is an anti-aging vitamin, and it's important to have that. The B complexes are important for your skin, such as for acne and for hair growth, for example. So make sure that you've got a good supplementation. Make sure that you get enough sleep, because sleep is essential for healthy skin. And try not to sleep on your face. It's much better to sleep on your back, where you're not crinkling and wrinkling your skin while you're sleeping. And also, the fluid can drain from your face, and you'll get less puffiness if you sleep on your back as opposed to your face. Other things are not to smoke, and try to avoid highly polluted areas if you can. Don't go out exercising when it's a high smog day outside. Stay indoors, exercise indoors, but do exercise. Exercise is very good for your skin. I do believe that management is also very important for overall health, and whether it be through prayer or meditation, or listening to beautiful music, or whatever you need to do in order to relax, lower your heart rate, and feel good about yourself. And then by all means smile. You know, sometimes if you smile when you don't really feel like smiling, you'll feel better. And smiling can become part of your daily routine. So just a smile, it's not a grimace. So have it be a sincere smile. Put a few funny pundits on your cell phone, or go into iTunes and download a few comedians so that when you need a good laugh, you can have one.
Oh, fantastic. Now, we kind of touched on this earlier. Does sugar cause aging of the skin?
Well, sugar is one of the things that I think in moderation a little is fine. But I think we clearly in the United States have too much sugar in our diet. I think that we eat too many sweets. And I think if you can make choices that exclude some of the sugars, I do think it's important. I do personally avoid sugary snacks, and I do advise my patients to try to limit the amount of sugary snacks that they indulge in.
Okay. Now, the question I have here is, do facials work?
Well, facials work to relax you.
Okay.
Facials work to stimulate circulation to the face. Depending on the type of facial, you know, it may clear out some of the excess oil on your face. So the only group of people that I advise to avoid facials are people who have an active inflammatory facial skin condition, such as active acne or active rosacea, and they have pustules. Mm-hmm. Another group that I would avoid facials would be anyone who has an active viral condition, such as fever blisters on their face. So, but I think if you have normal skin or dry skin or even oily skin, but it's not actively inflamed, that there is a place for facials. Okay. I think that if you want a facial to make you look younger for an extended period of time, it really needs to be a laser facial, okay, one that is generating energy and heat in the second layer of skin to stimulate collagen production. But a relaxing spa facial, I think, has benefits to relax you, to stimulate circulation to the skin, to give a temporary firming of the skin, and certainly has benefits.
Okay. Now, here's something that kind of ties into that. Are makeup and cosmetic products bad for your skin?
No, not necessarily. I think the most important thing up in cosmetics is to, first of all, change them out so that you don't have contaminated makeup. Okay. You know, everything has an expiration date, so, you know, throw things away once or twice a year. I think that the other thing is just to make sure that before you go to bed at night that your face has been properly cleansed, and allowing the cellular turnover to occur more efficiently. And if you go to bed with makeup on, that is a process that will be compromised. So as long as you take the makeup off and it's a makeup that suits your skin type, I think makeup is definitely of benefit.
Okay. Now, I know we touched on this a little bit earlier as well. What are the effects of the different seasons on your skin?
Well, the major, and it depends not just on the season, it depends on geographically where you live. So, for example, if you live in the Colorado Mountains, the Rockies, you know that those altitudes suck the moisture from the air, and so your skin is going to be more prone to dehydration. So it's very important that you treat the skin with products that decrease something called transepidermal water loss, which is how rapidly water leaves your skin. And when the ambient humidity is very low, it's easy for you to lose moisture from your skin. So there are products such as hyaluronic acid and skin lipids that help to hold moisture in the skin and help you hold water in the skin. So that's something very, very important. So in general, the skin will be drier in the winter and oilier in the summer. So each time of year you have to take into account how you should perhaps change your wash. If you have dry skin, you want to avoid foaming face washes and you want to go with something that's creamier. If you're earlier, you can then go with a more of a foaming face wash or a gel face wash. So you want your face after you cleanse for it to feel clean and firm, but you don't want it to feel tight and dry. And so that's how you kind of judge if you're using the right cleanser. And other changes that might be needed is that in the winter, if you're dry, you might want to use a cream, whereas in the summer, if you're oily, you might want to use a gel or a serum. But in the wintertime, if your skin gets less oily and it becomes a little dry, you might want to switch to a lotion. And if you have dry skin in the summer, you might want to switch from the cream you're using in the winter and switch it to a lotion to use in the summer.
Okay. Now that kind of ties into this. Your suggestions for a daily skincare regimen.
Number one is to use a sunscreen, and number two, at night, do something to improve cellular turnover. So that might be to use a glycolic acid wash, that might be to use a retinol product, that might be to do a little mechanical exfoliation and then hydrate the skin. But those are the two essential things. Protect in the morning and renew and repair at night. And then as you age, what you might want to add in the morning are antioxidants to protect from free radical damage in addition to your sunscreen in the daytime. And then at night to use other regenerative products such as products that are derived from stem cell proteins or peptides or growth factors and the such to complement the retinol that you're using to accelerate skin turnover. You use things that accelerate collagen formation. So those would be sort of examples of a yin and a yang. Protect with sunscreens and antioxidants in the morning, and repair and renew with retinols and exfoliants and peptide and collagen stimulation at night.
Okay. Okay. Well, to wrap up, can you tell us some tips for healthy skincare besides the daily regimen?
I think the most important thing for people who aren't happy with their skin is to don't pick at your skin. Picking at your skin and manipulating your skin only stirs up the inflammatory response that is giving you the skin you don't like. And picking can actually accelerate scarring. So number one, don't pick your skin. And if you have a condition such as acne or rosacea and you're using an over-the-counter strategy and say 4 to 12 weeks have passed and you're not seeing any improvement, please go see a board-certified dermatologist, because there are so many things that we can do to help you. And we want everyone to have a very confident face to face the world with. And we don't want people to feel self-conscious or unhappy about how they look. So try the other things, but if those strategies do not work, we have wonderful devices and prescription medications that can help many, many skin conditions that give our patients stress.
Fantastic. Well, again, Dr. Lupo, thank you again for your time, and thank you for doing this interview today.
It was my pleasure. Thank you, Victoria.